And now for more on this, Mehul Suthar, Assistant Professor of Pediatrics and member of the Emory Vaccine Center at Emory University, is joining us live from Atlanta. Now, we're witnessing a global Omicron surge. In your opinion, what can we expect in the next few weeks or months?
Unfortunately, with the recent surge of the Omicron variant, what we're going to experience is probably worse before it gets better. It's amazing how quickly this virus has spread from its first discovery in November to now spreading throughout the world. And we're starting to see surges in many countries right now.
Now, also, how long before we can conclusively know more about the Omicron variant in terms of its severity?
So this is a very good question. Some of the early reports from South Africa suggested that the virus may be causing more mild or moderate symptoms. However, if you take a look at some of the countries where there is a surge of this virus, such as the UK, Europe, Israel, the United States, what we're seeing is a rise in the hospitalizations across these countries. This may suggest that some of the early reports that it may be mild, moderate may not actually be 100% true. However, most of these hospitalizations are occurring in unvaccinated individuals. For those that are vaccinated, a vast majority of them are not experiencing hospitalizations.
Right. Also, for the sake of our viewers, can you explain how can COVID, especially the infection caused by Omicron, be differentiated from common cold?
Yeah, that's a great question. So there's many symptoms that are common between COVID-19, the cold, as well as influenza virus, which you're starting to see some infections occurring. Each of these are caused by a virus that infects our respiratory tract. So this naturally leads to symptoms that are very common amongst each of these infections: common cold, fever, cough, runny nose, sore throat. However, there are some features that do distinguish COVID-19 from the common cold or flu. This may include a loss of taste or smell, and there may be a more prominent shortness of breath that may precede a pneumonia with COVID-19.
Right. Now, many nations are also reducing the isolation period from 10 days back to 5 days now. What has changed? Has the virus changed, or is it our capability to fight the virus that has changed now?
Yeah, so as we are well aware now, the Omicron variant is highly transmissible, much more transmissible than the Delta variant, as well as the Alpha variant that we experienced earlier this year. Given the recent surge of infections in many countries, some of the guidance that has been sort of given out is to reduce the quarantine time and the isolation time so that essential workers and individuals like hospital cares, doctors, nurses may be able to go back to work to be able to treat individuals who are infected. Now, has the virus changed, or has the level of transmissibility changed? Not so much. However, what some of the early reports are suggesting is that maybe after 5 days of experiencing an infection, the likelihood of transmitting the virus goes down. So I can't speak to the specifics of many of the other countries, but for example, in the United States, the Center for Disease and Control has suggested that after 5 days of exposure and one finishes quarantine, it's recommended that one still wears a mask afterwards. So there are certain guidelines that each country has instilled, and I recommend that each and every one of us look at those guidelines and make sure we properly follow them. Again, if one is vaccinated, you're more likely to be protected against severe disease and death. However, you're unvaccinated, you're more likely to be able to transmit this virus. So it's very important that unvaccinated individuals continue to wear masks so that they don't spread the virus as much.
All right, Mr. Mehul Suthar, thank you so much for joining us with all your inputs on that. WION is now available in your country. Download the app now. Get all the news on the move.